How does a PET scan help diagnose lymphoma? Imagine having a tool that can see inside your body and tell doctors exactly where the trouble might be. That's what a PET scan does, especially when it comes to diagnosing lymphoma. Lymphoma is a type of cancer that starts in the lymphatic system, which is part of your immune system. To understand how a PET scan helps, let's look at what it does and why it's so useful. A PET scan uses a special radioactive sugar called fluorodeoxyglucose, or FDG. This sugar is injected into your bloodstream and travels to your tissues. Cancer cells, including lymphoma cells, tend to use more sugar than normal cells because they are more active. The FDG accumulates in these high-activity areas, making them light up on the scan. This helps doctors see where the lymphoma might be growing, even if the lymph nodes look normal on other scans. One of the biggest advantages of a PET scan is its ability to detect cancerous activity in lymph nodes and other tissues. Since lymphoma cells have increased glucose metabolism, they show up as bright spots. This helps doctors tell apart swollen lymph nodes caused by lymphoma from those swollen due to infections or other benign reasons. It's like having a metabolic map that highlights only the areas of concern. Staging is another critical part of lymphoma diagnosis. Staging tells us how far the disease has spread in the body. PET scans are very good at finding both lymph node involvement and disease outside the lymphatic system, called extranodal involvement. They can spot cancer in normal-sized lymph nodes that might look fine on a CORT scan. Combining PET with CORT scans, called PET-CORT, gives a detailed picture that shows both the metabolic activity and the exact location of lymphoma. This helps doctors plan the best treatment approach. PET scans are also valuable for guiding biopsies. When a doctor needs to confirm lymphoma with a tissue sample, they want to choose the most active area. PET highlights these areas, making sure the biopsy is taken from the right spot. After treatment, PET scans help determine if the lymphoma has responded. If the scan shows no more FDG uptake, it suggests the cancer is in remission. If there is still uptake, it might mean some lymphoma remains, guiding further treatment decisions. While PET scans are powerful, they do have some limitations. Certain types of lymphoma may not show much FDG uptake, making PET less useful for those cases. Also, because the brain naturally uses a lot of glucose, PET scans are less effective for detecting lymphoma in the brain. Steroid medications can also reduce FDG uptake, which might cause false negatives. In summary, PET scans provide a detailed look at how active the lymphoma is and where it is located. They combine metabolic information with anatomical details from other scans, offering a comprehensive picture. This helps doctors diagnose, stage, and monitor lymphoma more accurately than with traditional imaging alone. Remember, PET scans are just one piece of the puzzle and are used alongside biopsies, CORT scans, and MRI to give a full understanding of the disease. Always consult healthcare professionals for personalized advice and treatment options.